COVID-19 pandemic has, to a great extent, led to a decline in hospital visits across the globe as many patients stay away for fear of contracting the disease.
Well, it is for this reason that community health volunteers have stepped up to provide the much-needed medical services to millions across the country, more so for those advanced in age. Now, NTV on the road spent a day with volunteers from a rural village in this county and filed this report. In the remote Mudheni village in northern Tharaka Nithi County, we find Lucy Wanja, a community health volunteer, making the day's door-to-door visits. Her work begins at dawn every day and only ends when she's completed all her visits to designated homes. In such rural settings, healthcare services are rare, hence the need for volunteers.
Kazi yetu ni kuwatembelea watu vijijini, kuwafunza kuwa na afya nzuri, kuwafunza mambo na choo ili wasije wakala uchafu. Huwa tunarifaa tukimkuta mgonjwa nyumbani anaenda hospitali. Mimi huwa natembea kilomita 4 ama 3
Kila siku ama?
Kila siku.
This particular household, however, is close to her heart, she tells us.
Huyu mama ako na miaka 8, huwa aendi shambani, chakula ni kusaidiwa, huwa hafanyi chochote, ndio maana tumeonelea ni vizuri tumtembelee, tuwe tunamsaidia.
This is labor of love, they tell us, and more so during this period of the COVID-19 pandemic, which has caused a global apathy around hospital attendance.
The community health strategy has been very helpful. In this COVID-19 pandemic, we tasked them the role of community surveillance. They were put on strategic entry points, whereby they were checking for symptoms, people who may be suspected to have the COVID-19.
The volunteers are part of a larger community health structure developed by the national government to ensure residents at the grassroots level have access to proper health care.
Then it was reached that we needed at least 72 more units. So the county government initiated the formation. That is the time we created 72 more units. That making 72 plus 28, they made around 100 community health units.
The team is selected at a community meeting or baraza called by local administrators. Once selected, the volunteers undergo training to prepare them for the task at hand.
One CHV can have between 70 and 100 households.
The volunteers work under a community health assistant or a community health extension officer who subsequently reports to the county health department.